Good morning, everybody. Welcome back to my YouTube channel where I chronicle my weight loss and life and all that good stuff. So as you guys may remember, I had a Insta story on Instagram that I was asking for prayers and well wishes because last Tuesday I had a mammogram, which is my third one in 3 years. I have one every year. The first one I had 3 years ago. They sent me back a letter saying that I had what's known as dense breast tissue. After doing some research, I figured out that dense breast tissue is the type of tissue that breast cancer likes to hide behind. It masks it really well. And so, that visit, I learned that I had dense breast tissue, and so I made another appointment with a breast specialist, a woman who's been in that field for like 40-50 years, like a long time. And she was really good, and she talked about my lifestyle changes and how I've lost a lot of weight at that point, and that I get over 10,000 steps every day, and that she did a breast exam on me, and it said at that point that if I felt like I needed it, she would send me for an ultrasound, but that in her opinion, her medical opinion, I would not need that. I was not at a high risk. And at that point, they had informed me that I could do it every 2 years if I wanted. But because I have dense breast tissue, I decided to do it every year. So fast forward, last year's, I do it every September. And so last September of 2018, I did it again. Everything was great. Still, of course, the dense breast tissue problem, which is very common. And I have found out since then that people with dense breast tissue, it's like something that's in a younger body usually. Now I'm 47 years old, but I've always been told I got pregnant very easily in life, and even my last 3 or 4 pregnancies were over the age of 36. And most recent, my last one was, I gave birth to her, I think I was 42. But in any event, they had, associated dense breast tissue with having a younger body. And so that was no surprise because I've always been told that my insides don't match my age. But in any event, so last year's was fine, great. And then, so this past Tuesday, a week ago today, I went in for my normal mammogram. Now, I will say I had my period at the time. I had started the day before. My breasts were very sore, especially the one on the right, when they were smushing them down. And let's all be honest here, when you've lost an incredible amount of weight, like I have, you don't have much left. But because of that breast tissue issue, rhyming there, it hurt to smush them down and everything. And so the machine they use is state of the art. It's great. It takes the breast tissue and kind of does it in sections, yada yada. So the very next day I got a phone call, which got me so nervous. They called me and just told me that they had seen something on my mammogram on my right breast, and that they wanted me to come in as soon as possible to have a rescreening. And so they send you at this point to a place where they have a radiologist right there on staff to read the mammograms immediately. And they just told me that they would, it's like it's at our local hospital, and we have like a really great hospital. They specialize in transplants and I mean, you name it, they do it. And so they built this whole new breast screening and mammography center, and this whole cancer center, and everything. And so it's state of the art everything. It's gorgeous. And so they wanted me to come the very next day, but I couldn't work it out in my schedule. So yesterday I went. I was really nervous. I tried not to think about it because in actuality, the percentage of rescreenings that are cancer-free is high. There's only a 10% chance, I think it's 10% chance, 10% chance that you're gonna get called back for a rescreening. And of that 10%, it's only 0.05% that they will find something more. And so, so I went yesterday. I was a little nervous. As soon as I walked in, she showed me my mammogram and the piece of it, or the spot that they were concentrating on. And so basically they concentrated on that part and kind of focused in on that. And so they actually did a mammogram and then focused in on that direct area. And the direct area was only the size of like an eraser head, maybe even smaller. It was very, very small. And so they went in, magnified that area, and then they sent me to the waiting room. My husband was in the front waiting room waiting for me. And then I was able to find out that I am cancer-free, no problem, nothing, I don't need anything else, and I will just repeat my normal mammograms next September as I usually do and as I had planned anyhow. So, with that being said, thank you guys so much for going ahead and praying for that, and all of that, the thoughts, the prayers, the text, the Instagram messages that I got on my story, the separate emails and all that. I'm so grateful and appreciative to my community and my friendships that I have made. I'm very, very happy with that. So now let's move on to, this is my weekly update. But also yesterday, after that mammogram, I had a 3-year post-op follow-up with my surgeon. When I go to Glastonbury, Connecticut. They're just amazing in the surgical community for weight loss surgery, and I had always just gone to them for the whole surgery process because they are so highly recommended and highly esteemed. And so basically they went ahead and went over some of my statistics and went ahead on some of the things that I have accomplished and my weight. And so first off, let me say that my highest weight was 350. And when I started seeing them, I was like 333.5 was my highest recorded weight. And, or not recorded weight, sorry, when I started seeing the physician, the surgeon. And so I ended up, the day of surgery after the pre-op diet weighing 300.5. So I had lost 33 pounds during that time that I started seeing them. So yesterday, now my lowest weight, as you guys have seen recently, because I've been doing intermittent fasting and extended fasting, which has helped tremendously, my lowest weight is 165.1. And I fluctuate 165.1 to 167.1. It's like 2-pound fluctuation, but nothing more than that. I really am staying on track. I really am doing the intermittent fasting every day, and I do feed my body well, and I am eating only 2 meals per day. So yesterday, of course, when we all go through the same thing as far as stepping on the scale at the doctor's office. It's always so much more. But yesterday I actually decided on Sunday that I was going to start fasting right away, which meant that I hadn't eaten since Saturday evening. So I figured I would fast and I would do a great thing because of having to go to my surgeon's office and be weighed. I figured I might as well give it all I got and fast and not break my fast until after that appointment, because my husband had the day off and we were in Connecticut together and we wanted to go out to eat for lunch. And so it ended up being a little bit over 40 hours. By the time our food came and we ordered and everything, by the time I ate my first bite, I did 40 hours and almost 20 minutes. It was 18 point something. So say about 40 hours and 20 minutes. So that was great. And so when I stepped on the scale at the surgeon's office, I was 166.1, 166.5, which is great because it's only 1.4 pounds from my lowest, but that is my lowest I've ever been at the surgeon's office, because last 6 months ago, I was 180. And at that point, they had told me, you are a success story. With a VSG surgery, we let you know that you can lose between 65 and 75% of your excess weight. And at 180, I had lost the 75% or whatever it was. I forget what the numbers were. And so she said to me at that appointment, you're 180, and if you don't lose another pound, you are a success story. And she left it up to me what my goal weight would be, how I would feel at that goal weight, how I would do, and she left that all up to me. And so it was phenomenal to go back in there and report another, 13 point something or 13 point something pound lost in 6 months. And now at this point, 3 years out, that's phenomenal. That's great. And so she was elated. She told me that now I have lost 86 point something pounds of, or not pounds, it's the percentage of excess weight. So if the surgery guarantees 65 to 75, and I've lost 86% of my excess weight, she said that is just like out of this world. And so she was really happy. And then we talked about in October, so next month, I was supposed to talk at a seminar, at a support group seminar called Ask the Doctors. And basically it's one of their biggest they have. Every month they have support groups. Twice a year they have Ask the Doctor, and they have Dr. Papasavez, which is my doctor's partner in the business. And they also have my doctor, which is Dr. Tischler, on hand to answer all the questions. And so I think that's probably the one that I attended the first time I attended it, because that's where I got all my questions and everything answered, which was perfect. So anyhow, so I was supposed to do it in October. The doctor has some conflict in his schedule, so they're going to rebook him for November, and I'm going to be able to talk. So I was supposed to do October. I asked her if I could possibly do November instead, because I really wanted to be with that doctor that did my surgery. I love seeing him. He absolutely loves seeing me. He loves the success. And guys, really, 3 years out to be this successful and to continue the success is kind of unheard of for the most part. There are so many people in our community and so many people who do well that are just not on social media. And so I'm excited. I can't wait to see him. I can't wait to share my story and pictures and yada yada. And of course, I have till November, so I'm sure there will be a couple more pounds or a few more pounds lost. And so I'm so excited. So she did also say some other things. I'm going to be picking my mom up. She asked me to take her on a couple of errands. So I'm going to do that, and I'll be back when I come back and I'm at home. So I'm back. I'm home. Let me get right back into my video. So I went there and everything turned out great. The numbers looked great. They did do my panel. They drew 9 tubes of blood on September 6th. Yesterday was the 23rd. So we had almost 3 weeks for them to get the results. I live in Massachusetts. My surgeon is in Connecticut, so it does sometimes take some time for them to communicate. In any event, all my numbers looked great. My cholesterol, you know, the LDL and the HDL, I think it is, the whatever. I don't even know what stands for what, but they were all really good. She said that my B12 is high. Like, it was high last time too, 6 months ago. So I think I'm going to stop taking vitamin B12 altogether because it was like skyrocket high. Like, I think 3 times what it's supposed to. And the crazy thing is that I only take my B12, it's called B12 Plus by Berry Melts. I take 2 of those a day, but I don't take them very often. So I'm not quite sure why it's so high. And then my vitamin A is very low. And so I have not been good at taking my vitamins the last couple months. And so I need to find a better vitamin. And I need to find one that contains a high amount of vitamin A, which probably would account for why my eyes have been kind of funky. They're kind of going blurry. I don't want to say blurry, maybe cloudy, something. But they've been bothering me. So that may be why that is because I have a deficiency in vitamin A. So I'm thinking about maybe just buying a separate supplement. Let me know what you guys take for multivitamin. I don't want anything like a Berry Melt or a Bariatrics Advantage. I just want something I can just buy, whether it be on Amazon or at the pharmacy. Either way, let me know what you guys take. I was doing the gummies, and those are okay, but they do have a lot of carbs. For 4 of the ones I was taking, Smarty Pants, for 4 of those, the amount of carbs in that was 10, which I think is kind of high. That's crazy, 10 carbs. But we kind of talked about stuff that I'm eating and what my diet is, and about intermittent fasting and extended fasting. I don't know if you guys, if your personal surgeon's office has passed this information along, but mine told me 6 months ago that they were looking into the long-term successes of people who had weight loss surgery who intermittent fast, and that they were starting to tell their patients that this should be a way that they conduct their lives, like I think it's maybe 18 months and over. And so we had discussed that 6 months ago. I told her I was doing it already. And so she asked how that was going, and she asked me how many hours I intermittent fast, what the schedule is. And I told her it's 18-6. So I stop eating at 6 p.m. and then I eat again at noon. Some days I'll eat earlier, like today was one of those days. I woke up this morning, I had a hard-boiled egg, and then I also just ended up eating my lunch. I think it's probably approximately noon. I told her some of the stuff I was eating, and she said that was great. I told her I eat only 2 meals per day, about maybe 1,100 to 1,300 calories. And protein is about 65 to 75 grams, sometimes 80 grams. She said that was great. I'm going to do a what I eat in a day video soon. I have not done that yet. But I will say that today for lunch, I'm kind of going back. I'm kind of craving some of the foods that I had when I was in the puree stage, kind of. And so I picked up some fat-free refried beans from Trader Joe's, 2 cans. And so I had 3/4 of a cup of those beans with 1 ounce of mozzarella cheese on top. And I don't know, it just hit the spot for some reason. I had been craving it. You know, the carb count is not ideal. It's like 33 grams for what I had, minus 10.5 for fiber, but it's still, 22.5 grams of carbs just for that small bowl. But it is what it is. I am 3 years out. The carbs don't bother me as much, although I will say I am definitely low carb. Definitely every day I'm getting less than 50 grams, most days 30 or lower. So yeah, so I know that it's not something I'm just going to negate and just feel like, oh, I don't have to be low carb anymore. I definitely will be able to be eat normal and kind of eat keto and paleo and all that. We talked about measuring and weighing and MyFitnessPal. We talked in length about how that has really added to my success, which I totally get. I think that if I stopped posting on MyFitnessPal, I think that is the first alarm that should sound in my mind that I'm going on a downward spiral. And I've seen this in the community with some of us as well. We stop posting on whatever app you're using. Then next we stop doing videos on YouTube. Then next we stop the Instagram. And then next we stop the weighing and all that. And we stop getting on a scale every day or once a week or however often. And then before you know it, someone has disappeared. There's many people in the community who I definitely can think of that were here like 3 years ago when I was pre-op, that are no longer here, and then some that disappeared and then have come back with a huge amount of regain, not necessarily on social media here, but on my personal Facebook, that I see them coming on in groups that I'm a part of as far as bariatric surgery. And so I think for me that is extremely important, that I continue to be successful and I continue to work the plan to work, all that. I need to be able to do that. And so personally for me, it may not be for you, but I know for me, the success really is. And as she said, with the numbers that they see in this surgeon's office, he has surgery every day. Like there's most likely not a day that he gets off. He may take a day off and then his business partner, the other doctor there will take over, or there's other doctors within that hospital that will do it. And so they fluctuate like that. But this team is extremely busy performing the surgeries, and they have a high success rate. And that's what they have told me all along when I was pre-op and when I had my surgery, and now so far out, they're saying the same thing. And that is really the key. The key is accountability, putting in those numbers, knowing what you've eaten prior to eating it. Because I know for me, I could eat something thinking that it was healthy and then input it after I've eaten it, and I just feel like a failure. And so weighing, measuring, logging, having a diary if you feel like it, making videos, making Instagram posts, Facebook posts, something that keeps you out there accountable to everyone. And so, yeah, so I know that has been really the key to my success, has definitely been. As of today, I have logged 1,182 days in a row. That is when I started in June of 2016 logging. That is when I started. So I think it was like June 6th of 2016 or June 4th of 2016, and I had surgery September of 2016. And so I had gotten right in the habit pre-op. And I know if there's anybody watching here that is thinking of the surgery, or you're still in the pre-op stage, please heed this instruction for your journey, which is, please, whatever you're going to do after surgery, start now. There's no reason that you have to start after surgery. Start now. Start logging. Start thinking. Start everything. Just set yourself up for success. Meal prep, that is huge. I told her yesterday that prepping and measuring it out and having it ready for me is huge. That really is, it goes with all the measuring and weighing and logging and everything. Just meal prepping, and make sure that you're not going to the refrigerator starving and you're going to be looking around thinking, what am I going to have to eat? And then you start shuffling through and you just want to shove something in your mouth, and you end up making a poor choice because you don't have anything readily available that is healthy. So my appointment was great. I'm going to see her now every year instead of every 6 months, since I'm already 3 years out. But as always with my surgeon's office, she asked me if there's anything at all that they can do for me yesterday. She said, are there any other, besides the support groups that you're going to speak at and go to, is there anything else that we can provide for you? Do you want to see the nutritionist? Do you want to see the dietitian? Do you want to see the surgeon? Do you want me to give you a referral to a skin surgeon, plastic surgeon? Do you want anything that we can do? We're here. So before we don't see you for a year, if there's something you need, let me know now. Any questions? Anybody you want to pull, you want me to pull in here or hook you up with that you need? And I told her no, that I felt great having a YouTube channel and Instagram and this community. And I told her, having my Fitbit on my wrist all the time and making sure I'm tracking what I'm eating and all that, all those successful keys in my tool belt, along with this surgery, which is only a tool, you really have to work it, that I was good with all that. And so she did tell me I will see her next September of 2020. If I need anything from now till then, she is available. She said, if you want to see the dietitian, if you want to see the nutritionist, if, there's a topic you want discussed at a future support group meeting, anything like that, all I have to do is call and I can get right in, which I thought was really cool. So that's it. I don't want to talk your ears off. I'm sure that I have gone way over. But that is what I learned from my 3-year post-op surgery appointment. One last thing is every time I go in, they check my stomach. I lay down and she just pushes on my stomach and kind of feels around in there. And yesterday, because I'm so thin, she felt like she was going to go like through my body. And so she's like, ooh, I can feel every organ. Ooh, it was kind of funny that, when I first went there, that was not the case. And when I went there, a month, 2 months, 3 months, 6 months, 9 months, 12 months, 18 months, whatever, that was not the case. And so that was kind of cool. Kind of uncomfortable though, but kind of cool. So that's it for now, you guys. I hope that wherever you are on your journey, that you make it a great one. If you have any questions or you want me to do anything, upcoming videos, please let me know. I have a ton of information that I just need somebody to ask and I'll dump it. All right, guys, have a good day.